So let's start with the anatomy and physiology review. So this should be a review. However, I'm going to assume you don't know anything because I don't know how prepared you are. So what we're going to do is just take our time and systematically go through this, but pay close attention and make sure that you're really mastering the basics. Okay? So, first up, we've got the anatomy, the chambers, the valves, the blood flow, and the vessels. Okay, so just right off, let's just see what you know. So how many chambers are there in the heart, for instance? How many chambers? All right, what do you say? What do you got? All right, yes, there are 4 chambers in the heart. We're going to talk about what they are. How many valves are there, for instance, within the heart itself? All right, so just like there are 4 chambers, there are also 4 valves. And apologize, my throat's getting a little sore. I've been teaching a lot over the last few days. Okay, now when it comes to the blood flow, how well do you know the blood flow? Okay, for instance, how many places does blood enter the right atrium? What do you think? 2, 3, 4, or 1? All right, I'll talk about that. And then the different vessels. So as blood, for instance, leaves the aorta, what vessels does it travel through? And what are the branches off the aorta? All right, you ready? Let's get into it. Okay, so we're going to start off with the heart. So I'm on page 4 in your workbook. Everybody there? Give me a thumbs up if you're there. Okay, I can't see you, but let's just get into it anyway. Okay, when it comes to the chambers of the heart, there are 4 chambers of the heart. How many? Talk back to me. That's right, there are 4 chambers of the heart. What are they? Those chambers, if I look, well, first let's orient ourselves, okay? And by the way, this kind of head-on view, this is assuming the normal anatomical position where you are facing the patient. So if I'm facing the patient, what's on my left side is the patient's right side, and what's on my right side is the patient's left side. So looking at everything, of course, is in context of the patient. Looking at the patient, this is the patient's right side, this is the patient's left side. Everybody with me so far? Okay. Now, the way in this view, it looks like everything is just at a 90-degree angle, but that's not exactly how the heart is situated. The heart is kind of rotated. The normal situation for the heart is the heart is kind of rotated toward the left. So it's sitting kind of on the left side anyway, and it's rotated toward the left. So this is not the actual view that we see in the heart when we're looking at it. Just know that it's kind of twisted a little bit. But for drawing purposes, we need to do it this way. So we have the right atrium. What is it? The right atrium. We also have the right ventricle. Okay, so we have an atrium and a ventricle on the right side. We also have an atrium and a ventricle on the left side. But when we put these two together, these are called the atria. The plural of atrium is atria. So we have the left and right atria, and then we have the left and right ventricles. So the 4 chambers total: right atrium, right ventricle, left atrium, left ventricle. Everybody good with that? How many chambers again? That's right. We have 4 chambers: right atrium, right ventricle, left atrium, left ventricle. Okay. Now let's talk about the valves of the heart. So now we're talking about the valves. Okay. So when it comes to the valves of the heart, we have what are known as atrioventricular valves, and we also have what's known as semilunar valves. Now, let's break this down. Atrioventricular. Well, that makes sense. That should be valves between the atrium and the ventricle. Yes. So on the right side, for instance, there's a valve between the atrium and the ventricle. And then on the left side, there's a valve between the atrium and the ventricle. Okay. So on the right side, so here's where I am right here. Between the right atrium and the right ventricle, there is a valve. This valve is known as the tricuspid valve. So on the right side, the atrioventricular valve is tricuspid. Okay? All right, so go ahead and fill that in your workbook. So that's tricuspid. I'm on page 4. Now, staying on the right side, let's see, staying on the right side, as blood goes into the right ventricle, it then leaves and goes through another valve. So blood came into the right atrium. We'll talk about that in a moment. It went through a valve and then it got into the right ventricle. From the right ventricle, it goes through another valve before it gets to this section. This section is called this section here is called the pulmonary trunk. But before blood goes into the pulmonary trunk, it goes through a valve. That valve is known as the pulmonary valve. Okay. Now, some books will say instead of pulmonary, they'll say pulmonic semilunar. Whether you say pulmonic semilunar or pulmonary, same thing. We're talking about the same valve. All right, let's go back to me on the screen. And by the way, thanks, team. So let's go to the left side. As blood, I'm going to skip over and I'm going to now say blood has gone through the next steps and then it's gotten into the left atrium. I'm going to come back to that in just a moment when I get to the blood flow part. But let's just talk about the valves right now. So once blood makes it into this left atrium, it now goes through a valve on the left side, the valve between the left atrium and the left ventricle, or the left atrioventricular valve. It's known as the mitral valve or bicuspid. Mitral, okay? And I want you to say mitral. Notice that mitral has a L in it, just like left has an L in it, okay? Because the mitral valve is on the left. Now, mitral also is known as the bicuspid valve. Another name for the mitral valve, the bicuspid valve, is also the bishop's mitre. So, for instance, you know how like the pope or bishop, they have that tall hat that's called a mitre? Well, that valve kind of has that shape, and so sometimes it's called the bishop's mitre, but we will just use mitral, or sometimes I'll say bicuspid, okay? Most of the time, I'll refer to it as the mitral valve. And then on the as blood leaves the, or I'm sorry, as blood gets into the left ventricle, then it leaves the left ventricle and goes to the aorta. But before it goes into the aorta, it goes through a valve, and that is the aortic valve or aortic semilunar valve. Okay. All right. So we have four chambers: right atrium, right ventricle, left atrium, left ventricle. Then we have four valves. We have tricuspid, pulmonic, mitral or bicuspid, and then aortic. Okay. Now, why do you want to know this? By knowing the valves, for instance. Okay. So watch this. When it comes to the valves, we have an aortic valve. Now, this is not the order. So let me just write it in the order of the blood flow. We have tricuspid, then we have pulmonic, we have mitral, and then we have aortic. Okay. The way I remember the name of the valves is all physicians take money. Okay. But this is in terms of how you would listen for heart sounds, for instance. This is just a mnemonic for how do you remember heart sounds? All physicians take money. This is in terms of where do you place your stethoscope, but where you place your stethoscope and listen is not the same place as where the valve is located. Okay. But in terms of blood flow, it's tricuspid, pulmonary, mitral, and aortic. But for instance, just knowing the valves, now you can figure out valve pathology. So for instance, there's aortic regurg, aortic stenosis. There's mitral regurg, mitral stenosis, mitral valve prolapse. For purposes of this class, the EKG Mastery Challenge, I won't go really in depth with that. However, if you're wanting to know more, maybe you're a medical student, maybe you're a doctor, you're a nurse, and you want to take your knowledge to the next level, you really want to understand medicine, I would invite you to sign up for our Level Up Medicl Mastermind group. During the Level Up Medicl Mastermind, you'll find out more information about that later in the week, or you can just look around the video in the description. If you're watching this on YouTube, if this happens to be one of the videos on YouTube, most of them will not be, but if this happens to be one of them, check in the description. Otherwise, just go to levelupmedic.com and then click on the link on the homepage for the Level Up Medicl Mastermind. And that's our monthly program where I take you deeper, much deeper into topics. So, for instance, we start off with cardio, then rest, then renal, then we go to endocrine. And then after then, you kind of drive the ship and you tell me, okay, what do you want to learn next? But as I'm going through those different things, I will tie in the biochem, the physio, the micro, the path, the pharm, and so many other things. All right, so back to this. So we said there are 4 chambers and there are 4 valves, right? Okay, now let's get into blood flow. All right, so the big picture concept I want you to know here is the blood is having to come in through the heart and leave the heart every minute of every day. Why is that? Well, you have to maintain cardiac output, for instance, right? Okay. Now, by the way, what is cardiac output? Let me just pop that up on the screen for a moment. Let me get some space here. All right. So cardiac output, we know that is heart rate times stroke volume, right? Okay. Somebody tell me, what is the normal volume or the normal amount of cardiac output in a minute? What would you say? All right. So cardiac output is the amount of blood that comes into the heart and leaves the heart every single minute. So what is the normal amount of volume that should happen? That answer is cardiac output should be 5,000 to 6,000 milliliters per minute. Another way to say that is 5 to 6 liters per minute. Of course, we're talking about in an adult. And this is an average. It'll be slightly different for male versus female, but on average, we're going to say that cardiac output is 5,000 to 6,000 milliliters per minute or 5 to 6 liters per minute, okay? Now, so that's a lot of blood that's moving. If you imagine like a 2-liter bottle, right? That's up to 3 2-liter bottles are coming into your heart and leaving your heart every single minute. The reason that's so important is so that, for instance, the blood is carrying nutrients, it's carrying oxygen to all these cells and all these tissues throughout the body. So we have to maintain that. Well, that's a lot of energy and that's a lot of demand placed on it. So that's why it's so important that you're in good cardiac conditioning. Because, for instance, in the setting of heart failure, let's say somebody has left-sided or right-sided heart failure. Well, now their heart is not pumping as efficiently, and therefore blood, for instance, let's say oxygenated blood is not getting to all the tissues it needs, so you're not meeting the metabolic demands of the body. Let's get back to this. So when it comes to this blood flow, let's talk about it. So now we're talking about blood flow of the heart. So blood is going to, I want to draw your attention to the right atrium, okay? Because that's going to be our starting point within the heart itself. So from the body, so we're going to say from the body, okay, blood is going to come into the right atrium. From the top of the body, it's going to come in one way. From the bottom of the body, it's going to come in another way. And then within the heart, so you know how we have arteries? Well, running along all the arteries is a corresponding vein. So for instance, as the coronary arteries feed the heart itself, because the heart says, look, I'm selfish. In order for me to pump blood to you, the rest of the body, I need to get some for myself, right? I got to hold on to some. I've got to pay myself first, right? So the heart pumps blood to itself through coronary arteries. But for instance, there are also veins that drain from the heart, okay? So blood goes to the heart or within the heart through the arteries, but then it has to drain back through the veins. Well, all of those veins feed into a larger vein, and that larger, sorry about that. All right, so where were we? We were saying that, okay, so the blood comes, it drains from the heart through what's called the coronary sinus, okay? So the largest vein within the heart itself, where the venous drainage occurs, is through what's known as the coronary sinus. Say it again, the coronary sinus, and I have that on the screen, coronary sinus here. So in the right atrium, we have something known as the coronary sinus, but then blood comes from the head and the top of the body through the superior vena cava. Okay, say that one, superior vena cava. But then blood comes from the feet and the bottom of the body toward the heart through the inferior vena cava. What I want you to know is there are 3 places that blood feeds into the right atrium. How many? 3. Those 3 places are from the head through the superior vena cava, from the feet through the inferior vena cava, and then from within the heart itself through the coronary sinus. How many places? 3. Superior vena cava, inferior vena cava, coronary sinus. Everybody good with that? Okay. Now, at this point, we've got blood in the right atrium. Okay. So now the blood is here in the right atrium. Now, what I want you to know is blood is not just in one spot at one time. Blood is throughout the heart all the time. Okay. But what I want you to think of is, for instance, the 2 top chambers, the atria, kind of work together, and then the 2 bottom chambers kind of work together. But blood comes, for instance, into the atria on both sides, the left and right atrium. It comes into both of those first. And then once blood fills up there, and so what's the word for that? What's the word for the volume of blood that's coming, for instance, into the left ventricle? What's the word for that? That's the word that we call preload. So the volume that kind of pre-fills or loads up the ventricle is called preload. But before blood gets into the ventricles, it has to be in the atria. And then once blood gets into the atria first are at rest, then they depolarize where they get all excited and ready to go, and then they contract. And once they contract, the blood leaves the atria, for instance, and goes down into the ventricles. Okay? And then the atria would repolarize. And now the ventricles were at rest, and then they get excited. And then now, once blood is in the ventricles contract, and then they repolarize, and everything starts all over again. And this is happening literally every second of every minute of every year of your life. So, blood, let's go back to the screen. We said that the blood came into the right atrium. Now it contracts and it goes through a valve. That's the tricuspid valve. And then it goes into the right ventricle. Stay with me here. Everybody good? Now, once blood leaves the right ventricle, it goes through the pulmonic valve into the pulmonary trunk. Okay? Now, let's just stop there for a minute. Between the pulmonary trunk and the aorta, between these two, there's this little connection, right? What's that called? What's that little connection called? The anastomosis, or the connection between the pulmonary trunk and the aorta. All right, that's called the ductus arteriosus. And that's the thing that has to close, for instance, once a baby is born. Once a baby, for instance, especially passes through the vaginal canal and is now born and out into the environment, this new environment, the ductus arteriosus has to close so that the baby can actually breathe, because prior to then, there's an umbilical cord that's connected to the baby, and so that's how the baby's getting oxygenated blood flow, is back and forth through the umbilical cord. However, at birth, the ductus arteriosus needs to close so that the baby can now, so blood can go through the lungs and get oxygenated. There's an issue, for instance, what is that condition called when it doesn't close, and we need to either give medications or we need to do surgery to close that at birth? What's that called? Okay, that's patent ductus arteriosus, right? Okay, so let's go back to this. So there again, guys, remember those levels of learning. As we go through, I will tie in way more. So I know this is an EKG mastery challenge, but for instance, I want you to really understand. I don't want you to just have knowledge. I want you to really have understanding. Let's go back. Pop me up on the screen, please. Okay. And so blood is now in the pulmonary trunk. From the pulmonary trunk, it goes through the left pulmonary artery and the right pulmonary artery. So you have 2 pulmonary arteries. How many? 2. You have 2 pulmonary arteries that carry blood to the left pulmonary artery goes to the left lung. And then the right pulmonary artery goes to the right lung. For simplicity's sake, I'm just going to say lung. Okay, or lungs. Let's make that lungs. So where are we right now? Blood has gone, it came into the right atrium, got to the right ventricle, went to the pulmonary trunk, and now it's made it to the lungs. From the lungs, this is where blood gets oxygenated. So what are we saying? Prior to the lungs, a lot of people will say deoxygenated blood. I don't like to use that term. I like to say underoxygenated blood. Deoxygenated blood means there's like no oxygen really. There was some oxygen, it just wasn't enough, or it wasn't an adequate amount for tissue perfusion. So I'd like to say underoxygenated. So all the blood that was on the low pressure side coming from the body to the right side of the heart, all of that was underoxygenated. But after blood goes from the right atrium through the tricuspid valve into the right ventricle, through the pulmonic valve, into the pulmonary trunk, through the left and right pulmonary arteries, then blood goes into the lungs. Now it gets really super oxygen rich. We call that oxygenated blood flow. So let's go back to the screen. At that point, so blood has left the lungs and now it's going to come back to the left atrium. Now, how does it get there? It goes through 4 pulmonary veins. Now, you have 2 pulmonary arteries, but you have 4 pulmonary veins. Either way, whether we're talking the pulmonary veins on the right or the pulmonary veins on the left, either way, they all the blood ends up in the left atrium. Everybody good with that so far? Are we good? Give me a thumbs up if we're good. Okay, so right now we're talking about blood is in the left atrium. From there, the blood is going to go through the bicuspid or the mitral valve, and then it's going to get into the left ventricle. Now, all right, we're going to come back to left ventricle. I want to pause for just a second. Notice that I said tricuspid and bicuspid. Bicuspid is also known as mitral, also known as bishop's mitre. I want to focus on those 2 words, tricuspid and bicuspid, okay? The word tells you what it is. So for instance, let's look at the tricuspid valve. The reason it's named that is because when the valve closes, it actually has 3 cusps or 3 flaps or leaflets that come together. And so when all 3 cusps or 3 flaps come together and close, that's what it kind of has this type of arrangement. So that's why it's called the tricuspid valve. On the other hand, the bicuspid valve has 2 flaps or leaflets that close together. Okay, so bicuspid has 2 flaps, tricuspid has 3 flaps. That makes sense. Now, let me ask you, when it comes to heart sounds, what produces the heart sound? You know how like we've heard about the lub dub or what we really call S1 and S2? What produces that sound that we hear when we auscultate and listen to heart sounds through our stethoscope? What makes the sound? Okay, what makes the sound is the closure of the valve. It's not when the valve opens, it's when the valve closes. That's what produces the sound. Okay, of course, there are different sounds that we'll hear in different conditions. In the Level Up Medicl Mastermind, in the cardio part, I'll go into that in greater detail. All right, any questions so far? Let me just pop all that back up on the screen for you. Just make sure you got the story so far. So where we were is blood made it into the left ventricle. Okay, I know I'm just taking my time to carefully build the story, and then I'll speed it up when I put it all together. Blood is now in the left ventricle, and it goes through the aortic valve. From there, it goes into the aorta, okay? Now, from the aorta, we have the ascending part of the aorta. Then we have the aortic arch, and then you can't see it, but there's a descending portion as well. So the 3 parts of the aorta are the ascending limb of the aorta, the aortic arch, and the descending limb. All right? This comes into play, especially when we're talking about aneurysms, for instance. Or let's say you have a AAA or an aortic dissection or aortic rupture. Now we need to really kind of know those levels of the, or those structures of the aorta.